I'll actually intro Sarah because Sarah has been a close friend of mine for many years. And Sarah is one of the most compassionate humans that I know that also is highly competent. She is an acupuncturist. And for those that don't know, study both Eastern and Western medicine. So what's really interesting is she has both perspectives of really understanding. They have to learn Western medicine and then they go learn Eastern medicine, and it gives you a whole big wide range. And so I actually came to initially see Sarah when I was going through heavy adrenal fatigue and burnout. Used to be about 6 times a year I would burn out. And Sarah came to me and we were going through this initial intake. And one of the questions she asked me was, how much time do you spend receiving and how much time do you spend giving your energy out, pushing against the world? At that point, it was 0% receiving, 100% pushing. And in addition to helping me understand I was in burnout, was barely functioning. One, she helped me rebuild my adrenals, and there's some really clear supplements. But two, it gave me a much broader perspective on what's actually happening in the world. And so she's helped me bring myself back many times and start to change habits and patterns versus just quick fixes. And that's my current take, is how do I run the marathon? And for me, it's going to be changing some of these habits of running sprints. And in addition, we had her on to our podcast last time, and we talked about some of the really cool work she's doing in addition to adrenal fatigue and what it is and how it affects us and what we need to do to change. Also, what is ketamine assisted therapy and what does that look like? What are the results people are having? And I know it's really potent in our community. And so very different than people just taking ketamine, but actually using ketamine assisted therapy to work through PTSD, trauma, and a number of other things. So really excited to have you on, Sarah, and to join this conversation again.
And Sarah, sorry, when you were working with Josh.
Yeah.
That was basically right around the same time, Josh, that when we started K4, our two values were growth, because men must continually grow so that we can serve. That was the pushing out against the world. I need to keep growing. I need to keep serving. And you were burned out a lot. And I was bumping up against, like, I don't know if I can run at this pace.
Yeah.
And so we tacked in vitality as our third value right at that same time. So you were really integral to the addition of vitality as a core principle of our organization.
Well, not to focus on your health, Josh, but I remember the first time we had that conversation, you weren't even clear that that's what it was. I don't know if anyone had ever presented you with the idea of your adrenals being burnt out. And I remember you saying, I'm fine. And we started going through the list. And it was the first, I think, aha moment that you had around how much energy really needs to be directed back towards self in terms of working at the level that you're trying to work at.
Well, also, if you go to traditional doctors, which I've done, they don't, and I think you've explained it really simply. They just look at your cortisol at one snapshot and your cortisol may be fine. They don't recognize that it may be shooting out throughout the day, and they just capture one little snapshot and you're like, your cortisol's fine. They don't realize the energetics of what Eastern medicine looks like, very different than Western medicine. So maybe just for anybody listening, can maybe you start to unpack that, just so that conversation was just so relevant. It landed with so many people.
So if anyone doesn't know, adrenal fatigue is basically your adrenals are the part of your body that are just responsible for fight or flight. You know, traditionally they were used only in survival states. Your body blasts a bunch of adrenaline and cortisol. Your heart rate spikes, your energy moves, you can run, you can think, and then it's supposed to come back down. But for most of us that are in service all of the time, and especially after the last 3 years of everyone basically being in a constant state of fight or flight and survival, you're putting out these low grade levels and sometimes high grade levels all the time. And for some of you that are in service, I grew up in a family of Marines and firefighters and police officers. And so even if you're not doing these long days, if you're not doing these 12, 15-hour days, just having a nervous system that's being kicked into fight or flight for a sustained period of time can tap your adrenals. And so typically what we'll see is sleep will start to go, energy levels will start to go, mood stability will start to shift. And often my degree is in traditional Chinese medicine. My doctorate is there, but I've studied functional medicine and Western medicine. And so when you do traditional Western testing, they just do a quick little snapshot of where is your body at this moment. But cortisol fluxes throughout the day. It's constantly up and down. And so if they catch you at a moment where maybe you're activated, it could look normal. When if you run a full panel, which is a saliva test that's done every few hours over the course of the day, you can show that people are really suffering and it's just been missed. And it's not a fault of the Western medical system. They're just not taught the advanced training in school. And that's why naturopathic and functional medicines have become, I think, really vital to people as we kind of go forward.
Yeah. And I really liked, and I know we're repeating some of the previous one, but I think it was really helpful. You did an analogy of the adrenals and really helped reframe what they are, where they function, and that they're not just this thing that we can use and abuse forever without a cost happening. And so I think it's that metaphor of, which I'm very real now. Now it's actually progressed to the point of, if I don't change my habits, it's not just adrenal fatigue. It's actually my blood glucose spikes, the rest of my body starting to break down. And so it's not a choice anymore for me. I've reached the path of forced change, or my body's going to tap out and give me diabetes or other symptoms. So,
and we've talked about that in the previous podcast, and that your adrenals were never meant to work every day. They were meant to be these like executive functions for high intensity experiences. And so every time you hit a point of adrenal fatigue and you don't pay attention to it, your body pulls its bandwidth in a little bit more and a little bit more until you hit the point where you can still function at a high rate. You can still be very present and very accountable and do the work, but the amount of time your body is going to let you burn at that schedule gets smaller and smaller and smaller. So
maybe some symptoms, because I know for me, the way it shows up is I wake up tired. And again, usually when I'm in a normal space, I may be tired or like had a long day, but I don't want to go back to sleep. Literally, I was going to the gym. I would drink a little coffee. So stimulants, caffeine stops working. And actually I drink a little, I get about a 30-second feel good. And then I crash, and I was sleeping in my car before the gym. Like, that's how bad. And I was then adding more caffeine, which is the opposite of what you want to do. So for me, the caffeine stops. I get sugar and carb cravings. And then also my cortisol spikes at night. And so I can't sleep at night. It's like you're tired all day. Like, I just want to sleep. And then you finally lay down and you're wired and you can't sleep. So is there any other symptoms, just for anybody listening going, oh, that's me?
Yeah, the sleeping in the car to me is like late stage. I think if you're at the point that you're having to drag yourself around, you might have missed like a few red flags. I adore you, but sometimes that happens. But many red flags. Yeah. Little yellow flags. I think often the first things that happen, to me, it's sleep and mood are the first ones that happen, where you're not waking up feeling rested, even if you've slept for 8 hours, or you're struggling to fall asleep because that cortisol response is not coming down towards the end of the day. Or if you work right up until you go to sleep, if you work until an hour beforehand, it's just not enough time for the body to kind of set really strong balances between where's work and where's rest. And so your body's not worried about sleeping if it thinks that you're in a place where you need to run, essentially, if there's a survival aspect happening. So that's the first one. I think mood stability is the next one for certain. People will become a little bit irritable. Their bandwidth for other people's energy can get a little bit blurry in terms of what they feel like they can manage. And then as things get further and further, then you can be sleeping for 12 hours and still be exhausted. Caffeine isn't working. The mood stability, to me, gets significantly increased in the sense of the inability to perform little tasks. Sexual function can go, normal energy levels in terms of like muscle fatigue happens quicker. There's lots of just basic functions that start to shut down.
And hey, the only thing I will add is I had beat my porn addiction. And this last time I went through it, it all came back. And at first I was shaming myself and beating myself up. And then when I actually chatted with you again, was like, oh, my adrenals were shot. Light bulbs went off, and I'm like, oh, my body is so in burnout and so cortisol depleted. It's doing anything it can to try to get me back up because what you're doing is the body's trying to get heart rate beating fast. It's trying to get your breath up. And that's what that'll do to take you back up. So it's looking for a dopamine hit because I've depleted everything else. So it gives you permission to go, oh, it's my adrenals. It's not just some story I'm making up. And then doing so, there's really clear supplements. There's a really clear protocol to follow. And then 2-3 weeks into doing it, all those urges went away and I was back to homeostasis. Like, oh, thank you. I'm not this bad person, right? It's my nervous system taking charge and fighting for survival. So I wanted to put that in case anybody else has battled with any other addictions. And then the addictions come back and you're like, what's wrong with me? Yeah. It's just, you may be in adrenal fatigue, or if you push too far, like I did, and you get into burnout, the body will just take over and try to survive. So.
Well, and you're lucky, just to clarify on that, if you hit severe adrenal fatigue, 2 to 3 weeks to me, I just think your body's got some resilience and the ability to rebound. To me, I like to think of the energy in our body almost like a checking account. When you're younger, you have all this green that you're just playing with and doling out to stressful circumstances and long hours and partying and everything that comes in alignment with that. And as we get older and we've extended our energy and, families and children and purpose and all of those other things, the green comes down a little bit if the self-care tools aren't really, really in place. And so to me, once you hit adrenal fatigue, you're in the red. And so to do supplements for a few weeks will maybe get you right back at baseline, but you don't have this huge wealth to pull from anymore. It takes sometimes several months, if not, I've seen a year or two for people before who have really crashed the system to get back to a place that you're strongly in the green and your body's really, I use the word supporting, but to me, it's almost a trust thing, like your body's got, I like to think of it as has a really strong intelligence to it. And if you're not on the same team, it won't necessarily allow you to drive the ship anymore if you're constantly crashing it into rocks.
Anything for the person that is just like, hey, life is just normally, I'm tired is part of life. That's how life works. Is there a framework that because you deal with high achieving stress, people that are in stress all day long versus what life could be like with healthy adrenals that have been nourished and rebuilt, just the difference of those worlds. And I know you've also been through it yourself.
Yeah, I am not trying to pretend like I am holier than thou in this. I think you teach what you know. So I have been through this several times between med school and building my practices and sustaining. I treat a lot of trauma and PTSD. And so COVID was its own animal, just holding that kind of space 8 hours a day for people to essentially dissolve and kind of work through what they were working through. So I definitely get it. I think it's going to be different with everyone. And I think that's why it's so important to sit with someone who knows what they're talking about. What might need to pivot for you might be completely different than what, needs to pivot for Philip. There's going to be a through line for some things without question, but you have to look at everyone's individual lifestyle and what they have on their plate and where they can pull pieces in and how they need to supplement. It's individual. It really is. There'll always be some sort of boundary setting. There will always be some sort of supplementation, but it'll look different for everyone, for sure.
You mentioned the post-traumatic stress disorder, if it is a disorder or not, but really, the PTS is kind of this coping mechanism for people who have been in long-term stressful situations, whether they be entrepreneurs or combat vets. And so adrenal fatigue is not something that is really commonly talked about in the PTS conversation, right? So, and this might be at some point your segue into the ketamine, topic as well. But that's a really important joining of two big topics.
Yeah. Well, it's mind, body, spirit medicine, which is to me where everything is moving. You can't just treat the physical without treating the mental and the emotional. If you're really trying to build strong containers in our bodies, you can work on the emotional all you want. You can treat the trauma, but if you're not building up the reserves that were lost in the body, you're going to heal a percentage of the way. So it really does all have to be put together, in my opinion.
So just for guys listening that are like, I'm in it now and they recognize it, what's the plan to get back on track? If you were to say, hey, here, if you're in this place, you need to get back on track. Because some guys will be like, let me take supplements, but I'm still going to drink caffeine and I'm not going to change my behavior. I'm just going to try to supplement it. So maybe you could give a blueprint of what that would look like for guys to go, oh, how do I accept this is where I need to go?
Yeah. I mean, talk to someone first and foremost, again, because it's never going to be streamlined across the board, but there will always be some sort of supplementation. There will always, and usually I'll test patients if I haven't seen them before to get an idea of how deeply in it they are. There are 3 stages of adrenal fatigue. And so depending on where you fall on the map will depend on your course of treatment and how long we plan on kind of really going into this triage piece. But there'll be supplements. There will always be a really deep look at lifestyle in terms of where your boundary is with work, how your self-care is in place, where your personal time is. All of those pieces have to be looked at. And then there is a little bit of a change to diet, unfortunately. Caffeine, sugar, alcohol, all of those things doesn't mean you have to take them out completely. But I tend to see my first responders are literally drinking caffeine from the morning they wake up or to the time they wake up to the time that they go to sleep. And that is just requiring that spike that comes from the caffeine is happening because of your adrenals are secreting a little bit of a chemical. And so those things have to be adjusted short term. And then we just kind of put all the pieces together and figure out what's the best case scenario.
Awesome. Would you bundle nicotine in with caffeine? They're both in.
I mean, listen, to me, inflammation is inflammation. And it's the thing that everyone always kind of goes, damn it. Like anything that inflames your body is not going to be great for healing. And breathing anything into your lungs, whether it's marijuana, whether it's, nicotine, and I'm not anti any of those things, everyone can have their vices, but it's how deep down the rabbit hole do you want to go in your own healing? Like, do you want to support it 100% or do you want to support it 50%? And that's one of the conversations I have when I meet with people for the first time. Like, how deeply into this can you go so that I know where to meet you to support you? I can tell you everything I need you to do. But if you can't get rid of the coffee and you can't get rid of these other pieces, okay, this is the expectation moving forward for the next couple of months. So we're not trying to create new people. We're just trying to work with where you are and baby step you into a better place.
And just from a personal experience, in addition to the supplements, which really do make a big difference, but I like the morning routine of something. And so I've just replaced coffee with either mud water, or actually one of our K4 brothers created Lucid. Three of our K4 brothers have a company called Lucid, and they're basically they're coffee alternatives where they have like, I want to say like a third or a seventh of what an actual cup of coffee has of actual caffeine. And then it has like lion's mane and a bunch of other nootropics, which are essentially brain supplements in. And so I have that to kind of kick off the day. And if I do crave caffeine or coffee, I'll even do decaf. Yeah. And I found that at least replaces I keep the habit going, but I only give a little bit. And then that little bit of caffeine keeps something in my system and it reduces the process. So that's been really helpful. In addition to nighttime, I'm really putting a strong block 2 hours before bed. It sounds crazy, but I'll reduce the bedtime and I'll literally put a no-go zone on 2 hours before bed. And if I can slowly wind that part of my day down, which I actually modeled from Philip, he does stretching and he has this like wind down process where he stretches and plays some music. It just kind of winds down. And if I do that process, I get to sleep if I'm in bed before 9:30ish. If I hit to sleep before 10, I'm okay. If I'm past 10, I'm fucked.
Are you saying that you create a 2-hour window before you go to bed just for self-care, or work stops 2 hours before?
Work stops and then I do a 2-hour window. And so there's no work. It's literally just self-care. I even get rid of electronics and I'm like either reading or stretching or playing with my cats or like just being present.
I love them. Yeah.
Present. And then I dim the lights and it's just and at first it's actually massively uncomfortable at first because you're like, the dopamine, I want to do something with the dopamine. And that's the hardest part, is adjusting to like nothing. And then once you slowly start to adjust to it, it gets into this, like you look forward to it and almost want to protect it because it gets really inviting.
Well, and that's also the neuroplasticity too, which we can pivot at some point into the ketamine piece. When you have behaviors that you've done for so long, it's really uncomfortable to break them. It's the reason that we reach for our cell phones 100 times during the day. You do it so much, the brain is asking you to do it, even when there's no need for it. And so when you have a 20-year ritual of coffee, or what bedtime looks like, the body is firing, like physically firing channels and pathways to get you to do that thing. And so it's almost like breaking an addiction sometimes, but it pivots pretty quickly. Within a week or two, the body tends to let go of that response and move you to a different place.
I got a question about addiction as well. People, are obviously, we're all addicted to our phones. That's the dopamine swipe. Is there an addiction to what you're talking about with cortisol and adrenaline or norepinephrine from your adrenals, that you're not getting enough, and so you're intentionally pursuing either high risk behavior or some other hyper stimulating activity so that you are getting something? Is that related to
100%? And I think that can be adrenals, and also just the way that our bodies wire up. We see that in trauma all the time. People that are kind of coming from chaotic circumstances, that they realize the trauma, maybe they realize the chaotic relationships and parents, and they end up remodeling that because your body knows what it knows, and it will go towards the adrenaline spikes. It will go towards the dopamine hits. And I believe, don't quote me on this exactly, but the research is that they're called set points in the body. And so there are chemicals that there's a number that they're supposed to be at, the same way that we have a set point for temperature. We have set points for adrenaline about that. And so people who grew up in fight or flight circumstances naturally have higher cortisol levels, even if they developed a very peaceful existence, in their 20s and 30s and learned their way out of it. Their set point for cortisol is going to be higher than most people who don't grow up in trauma. So there's these little nuances of how the body heals and how the body grows. And so that also goes to having to sit down and have someone do an actual diagnosis of looking at your whole life and your whole patterning and trying to figure out, outside of draw some boundaries, here are some supplements, really nurture the whole piece of how we can start to bring things back into balance. Yeah.
And maybe even move those baselines.
Yeah, absolutely.
Hey, we thank you for listening to the Wenner Folsom podcast. Just a couple quick notes. First, if you are a man and you're looking for an honorable and inspiring group of men to hold you accountable and challenge you to grow in your relationships, your fitness, your career, your finances, and your life, go to www.k4men.com. And if you are a veteran, first responder, or man or woman who deals with trauma, and you are looking for some resiliency tools and skills for you, your team, and your organization, go to valorresiliency.com. Hope to see you there. Back to the podcast.
Absolutely.
Yeah, I was just going to say one other piece, because I've been intimately involved in this, is this was the number one piece of my porn addiction. It wasn't, there was other ones I investigated, like shame and some of the childhood responses I had, but it was more nervous system and my attachment to pressure and staying in a trauma response. And then everything I did was creating pressure. And from the way I worked, the way I trained, to all the stress I would take on, I would unconsciously get myself into high risk situations to create a lot of pressure to unconsciously recreate childhood high trauma environments to function. I thought I was at my best. And so this practice of healing has been
the devil,
Yes. And then the addictions were the way my body was trying to compensate, either bring me back up or down or offload the stress. So the major shift that I'm making now is removing stress, creating spaciousness, which is actually much harder than taking on more stress. For those of us that struggle with, like, I know, Philip, we've said active recovery and there's a lot of language we use, but what do you do in spaciousness? And what I will say is, you're forced to deal with what's there. You're forced to deal with the uncomfortable emotions. You're forced to deal with when you're dysregulated and using CPR and a bunch of other practices to regulate yourself. And so it forces you to create the spaciousness to do the work. And when you do, it really brings us back to ourselves. It's just fucking hard of spending multiple decades in a trauma response to avoid being with self. And then to create the spaciousness is just you.
Yep.
Like, I'll just share that from my own personal experience. I'm like, I'm just being with me. What's the resistance to create spaciousness to be with me? It's my emotions, my trauma, all that. And so when you can be with that, you get to this spaciousness, and meditation, again, is just a really good tool to be with that. So it becomes the practice. Just to give you guys permission, if it's scary or uncomfortable, it's naturally that way. But when you make that the practice of sitting with whatever's uncomfortable and allowing it to move, it really brings you peace. And then you model that to your kids and your family, and you change that lineage trauma. So powerful conversation. Let's move into the topic around the assisted therapy, so people have an understanding of what that's like and who are the ideal clients that come, and we'll just dive into that topic.
And so ketamine is one. I have 2 clinics in Los Angeles. One is my own private practice, and then I have a larger integrative clinic with a few colleagues who I've known for about a decade. And we're always bringing new things into the office and trying to support everyone in every way that we can. And so about 1.5 years ago, ketamine, which, if you don't know, has been legal in the US for several years in terms of medical use, for PTSD, for trauma, for pain management, for depression, anxiety, a lot of different pieces. And so we brought that into the clinic with the understanding that because my practice had been rooted in trauma for so long, that our MD oversees the program. We have our naturopath, Dr. Citron, and Dr. Farber, who's runs the ketamine program over at Cedars-Sinai, is one of our mentors in the program. And then I handle all of the integration. And so ketamine is a way to really rewire the brain chemistry at its easiest self. It works on, there's a lot of different receptors in the brain that cause the channels and the pathways for how we do what we do. And ketamine is a way to take it all offline for a few hours, And so when you bring it back online, you have this little window where you can start to rewire things a little bit differently. And so I've had people ask me all the time, ketamine was around in college. Everyone was depressed and anxious then. So with all medications, the way that you administer makes a big difference. I know if you have any familiarity with ketamine as a party drug back in the 80s and probably before that, when you do things nasally, which is how most people would take it, it's active for about 15 minutes. When you do it intravenously and in lozenges, which is what the government has regulated, it's several hours. Mm-hmm. And so you need these long periods of downtime to really take the brain offline. And then again, when we bring it online, we have a very specific program where we ask you not to engage in anything the rest of the day. You don't, have access to your cell phone. You're not discussing the treatment. It's as much of a body-based exercise as it can be. Mm-hmm. And so the treatments are typically twice a week for 4 weeks. We have in-office programs. We have at-home programs. And I have seen, I don't throw this word around lightly, but I've seen magic. I think it's going to change people's lives. The research that they have behind it right now is, I think it's 30% of people who are seeking either Western means in terms of psychotropic medications or talk therapy are considered non-responders, meaning they're not responsive to Zoloft or Paxil or whatever they're on, and they're also not responsive to their talk therapy. Of that 30%, 70% are responsive to ketamine. So to me, I think it's like the single most breakthrough change in mental health probably in the last 50 years. And I'm really watching incredible magic happen in the clinic. And so is there anything I can kind of dive in deeper into that piece for you before I?
Yeah, I think the only other piece that I wanted to speak on is because in addition to ketamine, I see the very same thing with somatic based work. And that's a lot of what you're doing. I know, because we've had bunch of conversations on the integration pieces. So if, hey, anybody that's listening and you can't quite afford the treatment yet and you feel like you need it, it's not all hope is lost. Start in the somatic based works, starting to get that through your mouth that move your body. Cause I see a lot of people just getting into somatic based where you're not dealing with talk therapy anymore. And from my understanding, just to explain cliff notes of the science, talk based therapy is when our amygdala gets full. Amygdala is like where we store trauma. When that gets really full and overgrown, and first responders and veterans and people that deal with high trauma, it doesn't go back up into what they call the hypothalamus, is the part of the brain that organizes thoughts. So instead, it sits there in like these big round fragments, and then we rep those. And so talk therapy is supposed to allow us to go back to organize our thoughts, to release them into that part of the brain. And so if that's not working, if you can get into somatic based work, what the somatic based work does is it allows you to go in and feel the sensations and get back into the body. And so the amygdala, the part of the brain that's the smoke detector, as how we've learned it in K4, is really just the smoke detector saying danger, danger, that is actually putting us in the fight or flight to take us out of the body. So just a general thought process, somatic gets you back into the body. So I would say if you could do the assisted therapy, yes. And if you're not quite there yet, jump into somatics and see if that starts to move the needle. And it'll also start to prime your body in the pathway. So when you are ready to do, or if you want to explore that, the pathways are built and you'll get there much quicker. So any other thoughts around that as well, Sarah?
I agree with that 100%. We've talked about this. We have a lot of therapists actually sending us patients at this point. I think you can't heal an emotional wound strictly with the mind, to be completely honest. I think talk therapy will get you only so far. And when they have these patients that plateau, you have to go into the body. And outside of the physical rewiring of the brain, I have studied a lot of the somatics that Josh and Philip teach in K4. And so our integration, rather than it just being a kind of go over of the session the day before, I'm actively teaching our patients these tools after every session, because we want them to constantly be engaged with their nervous systems to really bring these new pathways on in the most potent way possible. And so once they're finished with the program, they now have a really strong awareness of what's happening in the body that they didn't have before. I think the ketamine just opens the door and allows you some ease to really drop in to maybe feelings that you haven't before. When you take the brain offline, they found that it downgrades the amygdala quite a bit. And so they're finding that talk therapy for some people done with ketamine assisted therapy can be so potent, because you can go into these big traumas that maybe you haven't been able to speak about before without the body fighting against you. And it's really, really potent. And so I think you've got to have both. And to the part, I think when people talk about somatics, sometimes if they're not really versed in them, I hear people go, you just need to, calm down and use your tools when you're activated. But you have to accept the fact that your activations sometimes are false, and do the repetition and do the work enough so that when these big activations come up, your body even has the awareness to say, am I activated right now? Is this like a false alarm? Is this a true alarm? To sit down and get curious. And so the repetition of the exercises and the using of the tools every day, to me, is such a huge piece, because we don't want people reliant on medication. We want people to trust their own nervous systems, to know when they go offline, to know how to bring things back into balance, because that's what creates safety, not needing to reach for something every time you feel activated. It's just a kind of rapid tool to get you to the other side of this, but you're still using the foundations that you're being taught in K4, which is, I think, the magic in all of it.
Just to add maybe a highlight on one of the magics is you can't do this alone.
Mm-hmm.
And that's part of the conversation. And this is indigenous cultures from in every single area or era of the world, is we're always reintegrating men and women who have been through trauma. It's a well-established protocol that's just battle tested, is that there is always a purification process. There's always an emotional regulation process, whether that be a sweat lodge or it's psychedelics. And when you describe, you just did call it a sweat lodge, a purification, a ketamine treatment, then you need to not re-engage back into the battle. That's a vision quest. That means you need to go let things settle or resettle in whatever way they're supposed to. So, I mean, all of the protocol and the ideas, the themes that we're talking about are ancient, just anthropologically grounded in efficacy. All of this, it's just perfectly aligned. Really exciting.
I love that.
Yeah, and I thought it'd be a good timing now. We've been going a little while of like opening it up. So those that have been listening, and for those that are listening online and aren't live with us, we're changing the game up, and we've actually brought in our community. And so we'll have people answering questions that anybody listening may have similar questions. So we thought this may be a fun way to get other questions answered. So I'd say if you got a question, it could have been about anything we talked about or just in general, just go ahead and give us a little hand raise so we know that you got a question, and then we'll just go through. Or if you don't want to ask the question directly, you could type it in the comments. I know one of the previous questions to kick it off was about sleep apnea. That was related to the correlation with sleep apnea and how that also plays in. And I think that was you, Dallas, correct?
That's right. So my question was, because I have sleep apnea, I wear the apparatus. And my question was around, is there a correlation? Can the lack of sleep from sleep apnea give the same kind of symptoms as the energy drain and the tiredness of the drained adrenals? And also, does that same effect affect your adrenals?
Yeah, absolutely. So deep sleep is often what gets lost with sleep apnea if it's not taken care of properly. And even with great apparatus, I'm hoping someday we'll get to a point that the apparatus is really effective and easy, but not quite there yet. And so if you're not getting into deep sleep is where we do restorative. I'm not sure if you know that we sleep in about 90-minute cycles. And every 15, 20 minutes, the body is focusing on something else, memory processing from the day, the organ function. But there's the last piece, which is deep sleep. And that's usually what's lost. And that's where we really rejuvenate our bodies. And so if your repair process is gone, you're going to have to pull it from other systems. And your adrenals are usually the first piece, because they're going to give you a little bit of adrenaline and cortisol during the day to be up and be awake.
Thank you. That answers my question.
Of course.
That's also interesting. So deep sleep, if for those of us have the Oura ring, deep sleep is actually what we're tracking for restoration and restore.
Yeah.
Right. I like that. Yeah. Cause I've noticed less sleep sometimes, but I got a lot of deep sleep and I feel good. And the days where I've taken a sleep supplement, I may have slept longer, but it shows no deep sleep. And I actually feel tired and groggy is why I stopped trying different sleep supplements. So,
and that's the one that affects your readiness the most. If you're using an Oura ring.
Deep sleep.
Low deep sleep means that you're compromised.
Oh, interesting. What other questions we got?
Ooh, Sean Travis Number one, is cold immersion good to do when burned out or only prior to?
This is my favorite question because everyone likes the plunge right now, myself included. And so here's the thing. In Eastern medicine, cold is never good for the body. Cold is like the absolute stay away from, because it's going to stagnate your circulation. It's going to slow everything down, and kind of, we're energetic bodies. We're constantly trying to produce energy. And so we want warmth. Traditionally in Eastern medicine, you want the body to be as warm as possible. I like cold therapy. I do it all the time, but I do it in a sauna cycle. So if I'm doing cold therapy, I'm immediately going into a heated cycle after that to make sure the cold gets pushed out of my body. With that, and I will say this gently because I know that there are some just diehard cold plungers. I think some people do them for too long. I think sitting in a 10-minute cold plunge, and again, this is just my opinion and my training, out of whatever that pushes people into, whatever, state of feeling accomplished, is over long periods of time going to cause some damage to the body. I think if you're going into a cold plunge for 90 seconds with the intention of regulating your nervous system, which is how I do it. Often people jump into a cold plunge and they're screaming and they're yelling and their adrenaline is up. That's not what we want. If you're going into it as an ability to create bandwidth, to slow your breathing down, to get very meditative, that's great. I support that across the board.
Great. And there's a second question. He said, why does a workout kick me back into gear after being exhausted, after a few days on duty, or being activated? Isn't this more, stress on top of distress?
It is. It's both. Yes, sometimes people will use, it's a tricky middle road because you're going to burn off some of that external energy and the adrenaline that you're feeling in your body. But high intensity exercise also kicks your adrenals in. So it's a small balance where when people are in recovery, I'll say, listen, if you're doing this 5-6 days a week, can you do it 3? And then can we do some restorative exercise the other couple days? Like, I get that people need that to burn it off, but let's see if we can teach you some really intense breath work as a way of clearing some of that energy. Like, let's see what other resources we can use that don't fully depend on your adrenals to do that.
And then maybe cut down on the pre-workout, Sean.
Sean, do you do pre-workout?
I don't know. I'm just teasing. I don't know if Sean does or not. I don't know if he does or not.
Yeah.
I do not.
But, okay. Maybe that's just me.
Yeah. Do you pre-workout?
Come on.
I used to.
Don't shame me.
I have found caffeine-free pre-workouts in case you want them. I'll let you know.
What's
it's
the
not
point?
the same.
Okay.
It's just basically supplements to increase blood to the capillaries that you get a pump on, but you don't get the caffeine.
Ooh.
So
like mitochondrial support?
Yeah, it's like mitochondrial support.
I love it when you talk dirty, Josh.
You like that? You like those capillaries?
Yeah.
Well, side note, while we're on the topic, I heard that a hyperbaric chamber, just for anybody listening, increases blood capillaries in all areas. So I just heard about that. One of my buddies just sold one, and anybody, I know men, it's a common thing of like ED. And I didn't realize hyperbaric chamber is like one of the common places that you go to rebuild the capillaries, doing those regularly. So I learned that helpful hint last night. Thought I'd share it with you guys. So
Boyd has patiently raised his hand.
Thank you for noticing. Quick question it may not be quick. Sarah, I've noticed that SSRIs make the functioning of other drugs impossible. For instance, it stopped the effectiveness of mushrooms and MDMA.
Yeah.
How about ketamine? Will it have the same?
Interestingly enough, and SSRIs, I'm not into people suffering. So if your SSRI is working for you and it gets you to a place that you feel like you can struggle, great. But ketamine is one of the few medications that you can actually take while you're on your SSRIs and your other medications. You're technically not supposed to, just from a very purist sense, really dive into mushrooms and other medications if you're on an SSRI. And most of the indigenous leaders that I sit with in ceremony will not allow you in circle if it's been 30 days and you've had that in your system, because they're powerful tools. I mean, yes, it's ancient wisdom. Yes, there's so much knowledge and lineage in there, but some of them you can't combine safely. And I've seen occasionally a couple of really traumatic things happen when people mix on their own, because mushrooms are kind of hot topic, and DMT and ayahuasca and all of these things. And so I I think if you're sitting in those medicines, please sit with someone who's either very versed in the lineage or has, been indoctrinated into the medicine or knows what they're doing, because you can really screw your brain up.
Thanks.
Ketamine is safe. And when you go into programs again, in order to start our program, you get cleared by our naturopathic doctor first. You get cleared by our mentor over at Cedars. And then once you're in the program, I'm the person who's kind of angeling you through the process. But we have people do EKGs usually before they come in too, because we are trying to cross every T and dot every I to make sure people are really safe before they jump in. Yeah.
Just another note on that, Boyd. That's also what I've seen with almost across the board programs. The programs where they spend extra time checking you ahead of time before you do any of them are usually the safety ones, because they recognize the repercussions, and they don't just jump you in. They actually spend extra time, ask a lot of questions, and then they're extra particular, just really checking in with your heart, really checking in with where you're at, because that's where I've seen the complications is somebody not paying attention is where things blow out. So it just shows. So just as a side note, I've seen that quite a bit of the ones that feel a little safer if you're looking at different programs.
When being misdosed as well, the ketamine, the current day should be weight dosed. I think it's a milligram per kilogram. But again, that's something that very much we have patients who are huge men that we start on very light doses, because we want to make sure their nervous system, if you've never allowed full surrender in your nervous system, sometimes that happening can cause your body to go like, what's happening? If you're not someone who cries a lot or purges a lot or allows that to come through, it can be, even though your body won't be very reactive because the ketamine has kind of downregulated your amygdala, to come out of it and feel really vulnerable sometimes is a lot. So we're very careful with kind of deciding what dosages look like and how we move people through the program.
Thank you.
You're welcome.
So there's another question Garrett had about similar to effects coffee has on our natural responses. What are the effects of nicotine, like on sleep response, cortisol levels, et cetera?
So to be honest, I haven't done a deep dive on nicotine, and in a strange way, it's because I don't see it in the office that much. No offense.
The only thing I will say on it is just a personal share is when I was training for my show, I actually got really clean, and then I actually didn't realize what I was doing, but my nicotine habits came back, and I'd quit porn, I'd quit everything else. And then nicotine showed up, but I didn't catch it at the time, but I did it all the way through my training. And then afterward, I was trying to quit and couldn't. And I started researching it and actually realized it's a nervous system regulator, and it does both. It actually relaxes us and it stimulates us at the same time. So that's why it's really confusing with nicotine, because when you're depleted, it gives you a little kick. And when you're high, it takes you down. So it's actually a really tricky one that makes it easy to get hooked, because it's balancing you a little bit of both, but it gets harder and harder to do. So I realized it was just another crutch I used unconsciously. So I think that's part of it, is when we're leaving one, we typically go to another one. And so until we can find ways to do it normally without external influences, it gets really hard. So back to what Sarah said, is changing lifestyle, big picture, and a slow, gradual route is the only true way, or we'll trade one for the next one. But it's a slow, again, for me, it's slow, gradual. I couldn't rip the Band-Aid off. I needed titration.
I want to look into that, because it's not something I've ever read or been introduced to in terms of nicotine and cortisol. But is that more the addictive response, Josh, or do you know if it fires on the adrenals specifically? I'll get an answer.
When I looked it up, it actually fires on the adrenals. And so that's where I was. I think it was my unconscious way of finding it. I didn't track it, and I thought it wasn't. And so it wasn't until I researched it later, while I was back to feeling a little burned out. I'm like, oh, what else am I doing? And I was like, oh, I'm still doing that. And that gave me leverage to cut it.
It's a big purgative.
Okay.
It's an aspect of particularly North, Central, South American purification rituals.
Like hape?
Hape is tobacco.
Yeah.
And the same thing if you're purging with, for ayahuasca or any of these other activities, tobacco is going to be a central component to that. So I'm not sure how it affects what we're talking about with adrenals, but I do know it is a purgative.
I'll look into
function.
I'll look into it and I'll get you an answer.
All right. So we'll go ahead and finish up. Sarah, I know Ollie had posted a comment for those in here, but anybody else that happens to be listening, how can people get a hold of you if they're curious to learn more about, if they're like, I'm in adrenal fatigue, what do I do? Or they're curious about the clinic or anything else, what's the best way to get in touch with you, or how do they stay contacted?
So I have clinics in Beverly Hills and in Santa Monica. And so you can always come into the clinic, but I also do telemed services. So you could always call the office, go to the website, can schedule right online, which makes it really easy. And so sometimes it's just doing a consult for 30 minutes and getting an idea of if I think that I'm the best resource for you. I luckily have colleagues all over the country who I feel like if I don't have the best support, I can absolutely direct you to someone who is. So we have both clinics, we have online support. The Ketamine program is in office. We also have an at-home program. So I don't believe we can do that across state lines. You have to be in California in order to utilize that program. But again, I do have colleagues in other states that I could potentially refer you to if need be. The Instagram is under my business name, which is Meraki Wellness. And that's probably the best way, to get a hold.
And hey, I also know she does all kinds of functional medicine just because I know Sarah really well. She also does a lot of with like fertility. Anybody's working on fertility. I know that was like a highly specialized area and a lot of people are working on that. So just other people, I've referred other people to Sarah. And so just a really good resource for a lot of things functional, but that's another sweet spot of hers too. So
thanks, man.
Awesome.